Hello, my name is Brittany Thomas, and I did my change project on fall prevention. The goal of my project was to promote patient safety in 2 North at Raleigh General Hospital. Now, you might look at me right now and think I look pretty ridiculous with a yellow armband on and yellow socks on, but do we pay attention to these fall risk patients while they're in the hospital? And you know you're paying a whole bunch of attention to me right now because I look out of the ordinary. The objectives of my project were to develop an educational video for staff with a post-test. This video is to be reviewed biannually, and they had to make an 80% on this post-test. The video was an overview of the policy at Raleigh General Hospital on falls. The second objective of this project was to add a fall marker, some other type of fall marker besides the usual yellow socks, yellow wristband that could be placed near a patient to identify a high falls risk patient. Now, looking at our restraining forces, we had time, which that's always a restraining force for any type of project, resources, what the hospital was going to allow us to have, and what we already had that we could utilize, and staff compliance, which is always a biggie. Our staff member is going to be compliant with this new change that you're presenting to them. Now, the driving forces for the project were to increase patient safety. Patient safety is always a #1 priority. Another driving force was a need to inform the staff on the policy already in place. A lot of the staff members that I would ask if they knew exactly what the falls policy was, they couldn't tell me. So obviously they needed to review the policy that was already in place. And another driving force was awareness of the falls risk status of the patients that were already there. So the wristbands and the fall socks, you know, they don't stick out as much as they should. So we wanted to see what else we could do to basically put a neon light on these fall risk patients. Now, where I work, this is Raleigh General Hospital. Specifically, work on 2 North, which is a med-surg unit. It has 39 beds. 19 of rooms are semi-private rooms, and we have 1 private room. Our floor is made up of 14 RNs, 20 LPNs, and 11 PCAs. We also have 2 ward clerks, and we have quite a few travel nurses, a lot of people that have been there for over 26 years. So I had a great broad representation of different types of nurses. Now, the problem of falls is pretty vast. Last year's rates, a total of 132 total falls. This year's rates, and this is only until March, 153 falls. This is hospital-wide. But the numbers are drastic. Already in March, the fall rates are 153. So that's pretty drastic from last year. Utilizing a needs assessment to see what everyone on the floor thought we needed in regards to change. So I asked them, is fall prevention adequately utilized on 2 North? I distributed 47, 32 were returned, and out of those, 25 people stated that falls prevention was not adequately utilized on 2 North. They also stated that our assessment screen was not adequate, and our fall prevention packet was also not adequate. So we asked them if they thought it was good if we reviewed the policy on falls prevention. So out of our committee meetings, we figured out that we would make a video. This video would have the falls policy for Raleigh General, and that it would have that post test with around 15 to 20 questions, just so all the bases were covered. And that would be designated to be updated every year by the night shift charge nurse on 2 North. That way, every year it gets updated, people are still watching the video, people are still being aware of the fall policy. This is a slide about the post test. The post test had 20 questions on that policy, 80% for passing, and it's to be reviewed biannually. And I believe that twice a year would catch all the new employees that come to the floor, anyone who is a travel nurse new coming, that way they would know the falls policy as well. This is a slide that shows what our fall prevention packet includes, which we go by Everyone Lessening Falls, or ELF. It includes yellow socks, yellow bracelet, bed alarm for those high-risk patients, and our priority is safety. We want to make sure that patients are safe. But even with this packet, we're still having these increased amounts of falls, ridiculous amounts. So our new thing was red flags. That stands out a whole lot more than the yellow socks and the yellow bracelet. So the 3 highest risk fall patients on the floor now receive these red falls risk flags. So the flag, if someone is non-compliant to bed alarms, if they have any cognitive issues where they're getting up out of bed more than a regular patient and they are high-risk falls, and they have something wrong with their mobility. So if they have these criteria, cognition, compliance, or mobility, if they're the top 3 on the floor, you'll see one of these red flags hanging outside the door. That way, when a bed alarm is activated by a person getting up, we can run right to the rooms with the red flags, because they're the highest risk. They're most likely going to be the ones that have fallen into the floor. Overall, by the falls risk flags and the fall prevention video, we have seen a decrease in falls rates. Overall, there's increased awareness of how prevalent falls are in the hospital and how easily they can be prevented just by awareness of the high-risk patients, communication between nurses. So this slide shows we only had 2 falls in the past couple of months, which is great. That helps us with patient safety, and we just need to prevent as many falls as we possibly can. This is a list of my committee members. We're going to continue to try to meet about every other Monday, or at least one Monday a month, to go back over any falls that are happening on the floor, see how we could prevent that fall, how we could have prevented that fall, meet with the nurse responsible for that fall, see what happened, what we can do to prevent future falls. But this also helps increase the awareness of the falls on the floor and helps promote patient safety. And again, just reinforcing staff compliance. The more people are aware of these high-risk patients with the flags, with reviewing policy, the better our fall prevention packet and everything will be. So we can continue to improve our rates with new placements, such as a reassessment screen for high-risk medications, reviewing new medications that these high-risk patients or just any patient, once they get a new medication that would increase the risk for falls, having a screen pop up. And that's still in the making. Hopefully that'll be finished by sometime this year. And another thing that Raleigh General is looking at is a new bed alarm system called Sky Blue. This is motion detector with lasers. As soon as a patient steps out of a bed, we're notified, the staff is notified, and there are also video cameras on the wall. As soon as that motion sensor is triggered, it pops up a screen, so someone out at the desk can look and see what that patient is doing in that screen, instead of, oh, there's a bed alarm going off, but I think that's just this patient down the hall, it should be fine. Some nurses need to get out of that mentality. Therefore, this motion detector with the pop-up screen of a video would just be great at preventing falls. Sometimes you just can't prevent falls, as you can see here with this elephant and turtle. Falls happen, but we want to do the best we possibly can to prevent any type of falls, any type of injury in any patients. If you have any questions and want to contact me about any information, here's my email address and my name. Thank you very much.